Good evening, everybody. We've got Dr. Malcolm Mulholland here, Kiwi Bank New Zealander of the Year Local Hero Award winner and the chairperson of Patient Voice, along with a whole bunch of other stuff in the research for this, a flag expert, which was something that jumped out for me. So thank you very much for being here, Malcolm. Much appreciated.
No, thanks for having me.
My first question is actually going to be about the flags, and it's sort of a bit of a throwback question. What was your preferred choice for the flag referendum when we had that a decade ago?
Yeah, gee, what a loaded question to start with.
Sorry.
That's okay. Look, I I think eventually we will change the flag, and I think that the flag will have a silver fern of some description on it. It seems really obvious to me if you look back at our history that that's been our de facto symbol, if you like. Whether you look at military or produce or different areas of New Zealand society. So that would be my pick when we eventually do make the change.
So not laser Kiwi.
No. We were a little bit worried about putting it up, to be honest with you, Paul, because we thought people might vote for it, just as a protest or a joke vote. So, no, not laser Kiwi, though.
What was your reaction, actually, when you saw what John Oliver did around laser Kiwi?
Oh, yeah, I thought it was all in, good taste, good humour, really. Good to get the word out there. And, hey, if we can't laugh at ourselves, then what can we laugh at, right?
I'd just like to make one comment about that. What is it with John Oliver's fascination with New Zealand?
Probably the bottom of the world, and it's probably how they view us, really. They think we're sort of a throwback of some description, so maybe that's got something to do with it.
Him and Stephen Colbert seem to have this undying love for New Zealand.
Can you blame them? Best country in the world.
Absolutely.
But anyway, on to the more serious stuff. We got you here to talk about the health sector because recently the minister announced this big overhaul again. So what was your initial reaction to that, first of all?
I thought it was a good move to replace Lester Levy with a board. I think Lester Levy has left a trail of destruction behind him, and it was really obvious to me and to others that he prioritised the dollar over the health of New Zealand patients. And sadly, I think some of those moves that he made had come home to roost and adversely affected patients. So I actually applauded Simeon for the Minister of Health for getting rid of Lester Levy and replacing him with a board.
What do you think of the fact that he's denying that he didn't have faith in him when it's quite obvious that he did not have faith and he had to do the whole media thing? Yes, I did, but yet I shoved him out the door.
Yeah, I think they do that to avoid the golden handshake, don't they? They tend to sort of, dance around it in the hope that they can depart quietly. And I guess that's ultimately what's played out. But I think it was pretty obvious to, a few people, he didn't have the confidence in Levy moving forward. Otherwise, he would have kept him there, right? So, yeah.
Do you think it was all but a foregone conclusion once the other big wigs started leaving that Leicester was going to be not too far behind?
I don't know if it was that obvious at the time. I think quite a few people were surprised, especially around Di Safati's resignation as the Director General of Health. You'd probably say that it was a bit predicted with Margiapa because there had been discussion about whether or not to roll her contract over, and they never seemed to express confidence in her, or in particular, Lester Levy never did. So, yeah, I don't know if they're that closely related, and if we foresaw what was going to happen. So, yeah, hard to say, really.
One more question from me before I hand over to Paul. How concerned are you by some of the bigger things like the long waits in hospital, people getting turned away from hospital, and what are your organisation as advocate doing to combat that.
Yeah, so look, we're really worried about the wait times and people tuning up to ED and not being seen. So we've started a North Island roadshow to try and have conversations with the community to raise awareness about what we see as the big issues. I think what it boils down to, though, is just a lack of resourcing. One, around space, so that, the physical space of a hospital or an ED department. And then two, wages for doctors and nurses. That's why we can't retain them. That's why they go to Australia. So I'm hearing that constantly from communities that they're tuning up to ED and they're having to wait in some situations a couple of days, which is just not good enough.
Go ahead, Paul.
Well, I'm kind of curious. We hear from this government, we hear from all governments that their focus is always, getting wait times down, getting patients through really fast. This government has invested $16.9 billion over the next 12 years for the health sector. Do you see that making the impact that they want to claim that it's going to make?
It's really hard to do that until we see a clear plan moving forward, and that's the one bit of the puzzle that I think is missing. The other thing that I would say is that it would be really good if we had a really good oversight of what the main expenditure areas are within Vote Health. So I know that we have a budget of around about 30 bill, give or take, and I'd really love to see a breakdown of that figure even further. How much are we spending, excuse me, on our infrastructure, on our nurses, on our doctors, that type of data? Because I think until we can see that and have clarity of sight, then we can understand, where the main money is going and where it's being spent. So to me, there's still some curtains, if you like, that are holding us back from having a view of that, as well as I said to you before, a long-term plan. What is it? How are we going to get out of the hole, really, that we find ourselves in today?
And you've done a lot of advocacy work around access to drugs and medication. Last year's budget was not well put together when it came to that particular topic, and there was obviously the stuff that happened afterwards with the we'll take money from next year's budget and pay for these things now. Do you think the government's learnt its lesson? And what do you expect to happen this year in the budget around that kind of access to medication?
Yeah, look, I think everybody saw it for what it was, and that was a broken promise. And off the backlash of that, right, National did a big U-turn, and all of a sudden there was this money there. It showed to me a lack of understanding around the Pharmac model. So they didn't understand that they couldn't direct Pharmac to fund the particular cancer drugs that they wanted funded. I thought that was quite alarming, but I was happy with the outcome, regardless of how it came about. What concerns me now moving forward is that we've had a similar promise made in relation to blood cancer drugs. So the previous promise was only around solid tumours. So that's things like around the blood cancers, like myeloma, leukemia, those types of diseases. And I'd really like to see the government announce in this coming budget enough for those drugs to be cleared from Pharmac's waiting list.
Does it make a difference for you then from having Dr. Shane Retty in charge, who's a doctor, versus somebody like Simeon, who was a bank teller, when it comes to this decision-making process?
Yeah, good question. So I've met with both ministers, and I've only just met with Simeon. Quite a likable guy, to be honest, and I can see kind of why he got the nod. I think Shane's downfall was perhaps he got too down in the weeds. He was very much a man of detail, and so when you're trying to convey that to the public, sometimes it can get lost in translation. Um, Regardless of who the Minister of Health is, though, I would like to see some long term commitment to fixing the problem that we find ourselves in. Hate to harp on about the long term plan, but I just can't see what it is. And I'd also like to see them reach out to Labor and Labor to receive that invitation and go, yeah, let's work together because health is so important. If we can't get health right, then so many people are going to unnecessarily suffer. And that's what really concerns me.
How did you feel about the move from around the bowel cancer screenings that was announced, I think, last week, a couple of weeks ago,
Yeah.
where they took funding for specifically Māori and Pacifica bowel cancer work for people from, I think it was 50, and lowered the general age down to 58 for everybody.
Yep.
It feels like there could be some disparities in the outcomes from that. I'm kind of curious what your perspective on it is.
Yeah, look, I was really annoyed. I thought that they could have done both. So kept the screening program for Māori and Pacifica 50 and above and lowered it for the rest of the population at 58. I think what we have to remember is that we're dealing with a system that rations. And when that happens, some people miss out. Theoretically, nobody should miss out. Our screening age for bowel cancer should be 45, just like it is in Australia. And they made promises about that before the election. One thing that did disappoint me again was that we had no plan around what the government's going to do to alleviate problems within the pathology sector. So they're the people that look at the samples. We know that they're about to go on strike. There are massive issues within that particular workforce. That strike's happening at the end of the month, as well as what is the plan to get more gastroenterologists so that if somebody is said to have a high suspicion of bowel cancer, then they can go through the pipeline and be seen by a gastroenterologist. We've got a massive shortage of gastroenterologists, and that's playing out right now in the community I live in, Palmerston North.
So what do you think of Simeon's new catchphrase, I guess you can call it, timely quality healthcare? I find it a bit like awkward that he keeps pushing that narrative.
Yeah, that's a good question. I'm always a bit skeptical of catchphrases, and it sounds like a salesman, right? If I roll this out, enough people will believe me. The devil's in the detail when he comes out with sentences like that. Hey, that's great. You can have it there as an aspiration, but until we know what that detail is, then we'll know whether or not that can become a reality. And that's the bit that I never can have sight of. I'd love to. I'd love to go, yep, I can see your plan. I can see how you're going to achieve that. But I'm yet to see that level of detail.
Yeah, and what do you think will be the next step that you hope, or that they hope they don't do, or that you hope they do? So two ends to question there. So one that you hope they do, and one that you hope they don't.
I hope that they don't become wedded to the idea that we have to continuously make cuts in the health sector. It's one thing not to spend more, but it's another thing to actually try and reduce your spend. I think that the system is so stretched now, and I think we've seen some of that play out. Like, we know that they got rid of a lot of IT workers, and that responsibility is now being foisted upon other people in the workforce, and that's having a negative impact on their workload. So I would like to see them stop doing that. And I'd also like to see them bring together different stakeholders, the likes of yourselves and myself and clinicians and nurses and the unions, everybody in the room together to workshop, how we're going to get out of this mess that we find ourselves in. Unless we have that open, collaborative discussion amongst stakeholders, I really can't see the situation improving anytime soon.
In terms of the opposition parties that we've got at the moment, what do you think they should be learning from what we're seeing from the government?
Learning to listen. It sounds so basic, but ultimately this is what it's about. I'm kind of buoyed by the fact that we've seen some of the Labour and Green MPs attend some of our roadshows. We have sent invites to national MPs in particular, and they have always tendered their apologies. But I think you need to hear on the ground what is happening in their own communities, in their own backyards, so that they can get a sense of the gravity of the issue and then start to think, well, how can we fix this at a national level? So I'm kind of buoyed by the fact that I think Labour are listening. One thing, though, I hope that doesn't happen is that if we do have a change of government, so if Labour become the highest polling party and they collaborate with the Greens and the Māori Party, that they don't stop listening once they're in power, because I've seen that happen before as well. So that would be my one big wish to the opposition parties right now. Don't forget us.
In terms of the sort of redesign of the system, when this government came in, funding for GPs and primary healthcare sort of froze, didn't go up. Funding for medications, the $5 surcharge, for example, on medications was put back on for prescriptions. Do you think those policy changes have had an overall net positive or negative impact?
Oh, negative, without a doubt. One of the things I've been constantly hearing on the roadshow in relation to primary care, in relation to GPs, is that is where we're confronting the problems that we're now experiencing in our hospitals. The reason our hospitals are so log-jammed, if you like, is because people can't afford to see the GP anymore, and then they're going to ED departments. And what I'm also hearing is that when an ED department is full or has a particular reputation in the community, people from that community are then going to other EDs, time allowing. So, for example, I live in Palmerston North. The nearest ED to us is Wanganui or Whanganui. It's about an hour's drive. There are people who are commuting from Palmerston North over to Whanganui, so it's having a spillover effect. That to me is a disaster. But why? Because people can't afford to see the GP. They can't get in to see them if they're lucky enough to do that.
I remember a headline I think it was last year, 48-hour wait time at one stage at the ED at Palmy. It's got to be stressful for everybody involved. It's
Yeah, and my heart goes out to the workers because we are seeing failures in the health system in terms of care. So we are hearing about stories where patients are having to wait too long, and then as a consequence of that, their health deteriorates, and sadly, in some cases, they've passed away. Now, I don't blame the doctor and ED for that. I don't blame the nurses who are having to deal with this huge influx of patients. It's a system failure, and that's what we have to point out. We know, for example, there was one case in Bulla that happened where a man presented, was misdiagnosed, went back and subsequently died. Now, I don't blame the doctor who was, there was one doctor on servicing that entire community. That should never have happened, but sadly it did.
When it comes to that kind of primary healthcare, we know that if you look at the research and the stats out there, there tends to be a little bit more friction between Māori and Pacifica communities and accessing that healthcare. And that was something that the Māori Health Authority was originally set up to look at. Do you think that was the right way of trying to reach those communities and improve those outcomes? Or do you think it was a really big, grandiose approach that might not necessarily have achieved what it was hoping for?
Yeah. I think the expectations were too high on the Māori Health Authority. I think we all should have been realistic in our expectations of what it could deliver. One of the areas I would hope that it would focus on, and we would be aware that would be their focus, would be on service delivery. So one of the things that we all experienced, whether we're Māori or not, was the pandemic, right? And so what the government wanted was for everybody to be immunised. The Māori rates of immunisation in Pacifica was low until they started switching it to a Māori-friendly service delivery. The numbers, they sort of went up overnight. And all of a sudden, we all benefited as a result because then they could, reduce the restrictions that were in place. I think that's a really good example of where, Māori's solution for a Māori problem can really come into play. So if a Māori Health Authority is to be reinstigated, I would like us to all be realistic around the expectations. And, there do need to be some measures put in place. I don't argue against that. But I think we have to be realistic as well.
Now, one of your other areas of expertise as well is sort of symbols of nationhood, which I'm kind of curious how your perspective with what you're seeing with the health sector and what you've been through your own sort of history, as it were, with that and with things like the flag, how that fits into how we see ourselves as a nation and how others see us as a nation.
Wow, I wasn't expecting that question, Paul, but I'll give it a big shot.
I can go back to a John Oliver question. What's your favourite musical number that he's done?
No. It's all right. We can have a deep and meaningful. Yeah, I don't know if I'm going to answer the question, but one thing I would say is that it's really clear that there's an expectation amongst the public that we have a well functioning public health system. And we've heard time and time again about the social contract, right? We pay taxes, and in return for those taxes, we expect a good health system, regardless of where we live or what our ethnicity or our sex or whatever else comes with us. And I think people are feeling like that social contract has been broken, and so that's that's something that I've often reflected upon. I'm 48 years old, but I can remember once upon a time that you went to the doctor. You saw the doctor. You saw the doctor in a timely fashion, and you also got the medicine that you needed in order to recuperate. Same deal with the hospital, right? You present to an ED. You're seen shortly thereafter. If you need to be admitted to a ward, that's what happens. But that's not happening. And so when we think of New Zealand, we tend to think of, Michael Savage and the Social Security Act and all of that proud history that we do have, that we're sort of turning around and going, what happened? What happened to that? We need to be proud of it, but two, actually make it a reality. And I think right now there are people scratching their head going, I don't know what's happened.
My last question to you is: what is your opinion on this recently announced 3-month collaboration between the private sector and the general sector to do the 10,000 operations, I believe it is?
Yeah, it's an interesting move. It's not a new move. It's something that historically hospitals have done. They have outsourced to the private sector in order to get rid of the backlog. But we have to remember that often the same doctors are in both public and private, and that's quite a strange thing. So you can have an appointment in public, and say it's a gastroenterologist or a colorectal surgeon, and then be seen by the same surgeon in a private setting. And so we have to remember that the workforce is actually one and the same, even though we're talking about two different systems. So we are going to experience some stress and potential burnout there. I think in terms of a temporary solution, that was the only solution in front of the government, and I'm glad that they've actually done it. But longer term, we cannot be reliant upon the private sector. We have to have a well functioning public system. The only way we can do that, and from my perspective, is to actually pay the doctors what they would expect to be paid in an international context. So I know that the top oncologist here at Mid Central, he's reached his ceiling, but he would be on the equivalent of a starting oncologist in Australia. So unless we're actually going to be competitive around wages, I think we're forever going to find ourselves in this quandary.
Do you find it when you're talking to politicians and people sort of peripheral to working in the sector that they're aware of those disparities in the pay rates?
I think they are. I don't think they're always honest about it, though, Paul, to be honest. I think they, often will pull out the line, it's a competitive international market. Other countries are experiencing high demand for doctors and nurses. But what they don't finish the sentence saying is that, oh, and by the way, we don't pay our doctors enough. And that's why they're leaving, and nurses for that fact. So we have to be real, and we have to be open, and we have to be honest. Sometimes politicians aren't always like that, funnily enough.
Politicians aren't honest all the
time. Sorry. I'm going to ask you one more because I just thought of it. What would be now we're just about 18 months, give or take, away from the next general election. So what would be the one policy from each of the parties, the major parties, that you would like to see them campaign on to get back into government or to retain government within the health sector?
Yeah, it sounds like I'm sort of harping on the same point, but I want to see a plan that's properly budgeted. And I'm yet to see a long-term plan that will get us out of this mess from either party, for that matter. So I'll be keeping an eye on what their manifestos have to say. But until they actually come up with a long-term plan that involves all stakeholders again, then I think we're just going to find ourselves in this position. What saddens me, though, is that if we take the current government, for example, they're very hot on productivity and, having higher outputs, that type of thing. You've got to invest in your people in order for that to happen. If we've got sick people, if we've got people who aren't performing to the best of their health, then we're never going to be this utopia that, in particular, the National Party want. So we have to get our heads around that, and we have to invest properly in people.
Well, yeah, yeah. Thank you for joining us today.
Hey, thanks for checking out today's video. Make sure you like, share, subscribe so you get more updates as we go along. We deal with these guys for the rest of the year.